All right, welcome to This Explainer. Today, we are completely demystifying the egg freezing process. If you've been feeling overwhelmed by all the noise and conflicting info out there, trust me, you're in the right place. We are going to cut right through all that and look at the actual facts, the medical realities, and most importantly, the lifestyle choices that actually move the needle. Let's get right into it. So here's our roadmap. We're breaking this whole complex topic down into 5 really manageable pieces. First, understanding the basics of egg freezing, then the critical age factor, the essential do's, the crucial don'ts, and finally, how to actually manage the process in your day-to-day life. Okay, part 1, understanding egg freezing. Let's start by getting crystal clear on the exact medical steps involved when you choose to freeze your eggs. Honestly, it is so empowering to know exactly what's happening inside your own body. The core science here relies on a fascinating process called vitrification. This is an advanced medical procedure where your harvested eggs are cooled to ultra-low temperatures using liquid nitrogen. And what this does is it effectively hits the pause button on time. It literally halts all the biological processes for your eggs, which means there is zero deterioration in their quality. Doesn't matter how long they stay frozen, they remain exactly as they were. So how does this actually unfold? Well, it happens in 4 clear steps. First step is stimulation. This is where you take highly specific hormone injections to help your ovaries produce multiple mature eggs. Step 2 is the actual harvesting, which is a minor surgical procedure. Then comes step 3, the freezing or vitrification phase we just talked about. And finally, step 4 happens years down the line when you're actually ready. The eggs are thawed and fertilized using a really specialized IVF technique called ICSI, where one single healthy sperm is injected directly into the egg. Right, moving on to part 2, the critical age factor. Now that we've got the science down, we absolutely have to talk about timing because this is honestly the single most critical factor in your entire journey. Now, data out of the UK reveals a really fascinating but kind of concerning statistic. The average age women are currently freezing their eggs is 38. And look, while it is fantastic that women are taking charge of their fertility, experts really caution that this age is actually a bit too high for optimum efficiency. The biological reality, the simple truth of it, is that the younger your eggs are, the drastically better your chances are of a successful pregnancy later on. To really put that into perspective, let's compare the timelines. If a woman freezes her eggs when she's 35 or under, and she manages to store a good number of them, the cumulative success rate after 3 transfers can actually be as high as 70%. That's huge. On the flip side, eggs frozen over the age of 40 are significantly less likely to result in a healthy live birth. That's just because the quality and viability of the eggs have naturally started to decline by that point. This whole idea is perfectly summed up by Dr. Gil Lockwood, who gave a pretty stark warning about this. She noted that, unfortunately, many women are just leaving it too late. We have to remember that egg freezing is not a 100% guaranteed insurance policy. Waiting until your late 30s or your 40s directly and irreversibly impacts both the sheer quantity of eggs you can retrieve and their intrinsic quality. Okay, so knowing that it takes about 3 months for an egg to fully develop within a tiny follicle in your ovary, let's jump into part 3, the essential do's. You essentially have this critical 3-month window to create the absolute best physical environment possible for your eggs before you even touch an injection. First things first, what are you eating? Sticking to a Mediterranean diet is highly, highly recommended. We're talking lots of tomatoes, olive oil, sunflower seeds, fish, walnuts, the whole shebang. At the same time, you want to minimize heavy animal foods, fizzy drinks, and refined sugars. Studies actually showed this specific way of eating can favorably impact insulin resistance and help optimize your reproductive health right down to the cellular level. Next up, maintaining a healthy BMI is super vital. Research shows a really clear link between an increased BMI and lower egg yields. Plus, women with a BMI over 30 face a 3 times higher risk of infertility and tend to have a reduced response to the hormone treatments. But it's not just about egg quality. A healthy BMI actually makes the physical retrieval procedure much safer because it makes your ovaries way easier for the doctors to see on their ultrasound scans. Let's talk about targeted nutrition. You really need to discuss adding specific, research-backed supplements with your doctor. Things like folic acid and vitamin D are absolute musts and should be started well in advance. There are also specific supplements like Impril that are formulated to encourage metabolic balance and protect your eggs from DNA damage. But, and this is a big but, please avoid just taking a random handful of multivitamins. Mixing too many things can actually backfire and cause problems. And listen, do not underestimate sleep. It sounds basic, but a lack of rest can literally lower your fertility hormones while simultaneously spiking your stress hormones, neither of which is good for your developing eggs. You want to create a dark, cool environment, get away from those screens, and really encourage your body to produce melatonin. It doesn't just help you sleep, it is actively chemically good for your eggs. All right, so just as there are things you absolutely must do, we need to flip the script and look at part 4, the crucial don'ts. These are the pitfalls you have to avoid to protect your fertility. For starters, if you smoke, quitting is absolutely non-negotiable. Studies have found that the risk of infertility shoots up by over 41% for smokers compared to non-smokers. Smoking literally exposes your developing eggs to harmful environmental toxins that significantly decrease both their quality and their viability. You've also got to keep a really strict eye on your caffeine. The current NHS guidelines suggest capping it at 200 milligrams a day. To put that in everyday terms, that's about 2 cups of regular coffee. High caffeine consumption has been linked to lower fertility rates, so honestly, swapping to decaf early on is just a really smart, safe move. When it comes to alcohol, the data is crystal clear. Just cut it out entirely leading up to your procedure. Research shows a very clear link between even moderate drinking, like just a few drinks a week, and lower success rates in fertility treatments. You want your body in absolute peak condition, and alcohol just actively works against that. Now, this next point is absolutely crucial for your physical safety. During those hormone injections, your ovaries are working in overdrive, and they get dramatically larger. Because of this, you absolutely have to stop high-impact exercises. No running, no jumping, no kickboxing. If you do those things, you risk something called ovarian torsion. It's this painful, potentially dangerous condition where your enlarged ovary literally twists on itself and cuts off its own blood supply. Stick to gentle walks or swimming instead, okay? And finally, for the don'ts, never, ever take any new medications without getting explicit approval from your doctor. The fertility meds you're on are so highly calibrated to grow your follicles and prevent you from ovulating too early. Throwing an unapproved medication into the mix could dangerously throw off that delicate balance and completely ruin the cycle. Okay, so we've covered the physical rules, the science, the stats, but that brings up a really massive question. What about the rest of your life? How do you actually balance all of this intense medical stuff with your mind, your job, and your daily routine? That brings us perfectly to part 5, managing the process. Because let's be real, egg freezing does not happen in a vacuum. It happens while you are still trying to live your normal, busy life. Look, egg freezing is an intense process, and a lot of people go through it without a built-in partner or support system. That can easily amplify feelings of stress and anxiety. And here's why that matters clinically. Data links high stress directly to an increased risk of infertility. So prioritizing your mental well-being, whether that's finding a therapist or just really leaning on your friends and family, isn't just self-care. It's a medical necessity. Logistically speaking, you've got to plan ahead. You're going to need time off work for your monitoring appointments. You also have to master giving yourself injections. Oh, quick pro tip from the experts on that. Hold an ice cube on your skin for a minute right before the needle goes in. It helps so much. But most importantly, that final trigger shot has to be given at a very exact time, often late at night. And you must have a support person ready to drive you home and stay with you after the actual surgical retrieval. So let's wrap this up. While egg freezing is a truly phenomenal scientific advancement, it's never a 100% absolute guarantee. But by understanding the science, respecting the timing, and adopting these really actionable lifestyle changes, you put yourself in the absolute best possible position for success. The choices you make right now, in the months leading up to your procedure, directly impact the quality of the eggs you're storing for your future. So knowing everything you know now, how are you going to take charge of your fertility journey today?